Welcome everyone to probably your last video of me and me talking for the entire quarter and for hopefully for the entirety of human anatomy physiology. Hopefully this is your last week and a half of human A&P before you head into your next either biology course or maybe head into your program that you're going into, whether it be nursing or radiology or dental hygiene. And you'll get more A&P there, but it'll just be a little more specific to your field and more in depth. As things keep going up, they get more in depth in certain areas. You get to learn more about pharmaceutical interactions with, some of the like adrenergic or cholinergic receptors or drugs and how they interact with those and why that creates neurotransmitter problems, tolerance problems, in terms of the fact that we create more receptors and end up having issues there. So it messes up our upregulation and downregulation receptors. So you'll get to learn about all of that as you head into future programs and future courses. But I just want to let you know I appreciate all the work you've done this quarter and in 241, and I appreciate you as people and as students, and I hope you have a wonderful winter break, and I hope that you stay safe and healthy, and you and your family stay safe and healthy. And I just wish you the best in your future courses and future programs. And I'm always here if you have questions or need any support of any kind. That's what we're here for. So hopefully you've enjoyed this course. If you haven't had a chance to fill out the course evaluations, today's the last day, December 4th. So fill those out. Those are always helpful for me, helpful for our college to just as part of accreditation and getting student feedback. And I know that I'm already pretty open in the course, and you guys share information with me, and I ask for it, so I always appreciate that. To me, it's somewhat of a partnership in terms of how you get through these courses and learn, and I definitely have ideas and purpose for the way I do it that sometimes students don't understand or maybe don't like, and there's a reason why things are done that way, and they are generally very effective, and there's research that shows it. And so sometimes that's conflicted, and that's okay. Our job isn't to make everything perfect and that you love it all. Our job is to prepare you, right, and educate you. And sometimes that means it's tough and you have to grind it out. And this year's been a bit of that in general, outside of our control, right? It's been a lot of tough things and just things taken away from us. And I just I wish you the best to continue to grind it out and get through all of the weirdness and toughness and the stay-at-home orders and those kind of things over the next couple months. And know that there is light at the end of the tunnel, that your life that you saw last year before all this happened, it'll come back. But it's okay to be upset that it's kind of been taken away from you. So anyways, let's dive into the acid base and urinary system here a little bit. So you're in week 11. You may have already completed some of these activities. If after this video, if you feel like you can go back and edit them and resubmit them, please do so if what I say helps. If what I say doesn't help, then don't worry about it. You've already nailed it. That's fine. Okay. But the key with looking at arterial blood gases and compensation is understanding that our renal system, our respiratory system, and other areas in our body work together to maintain homeostasis in our blood, right? To maintain certain blood gases, to maintain pH, so that our body can operate effectively. So key areas you're going to be looking at with arterial blood gases that they look at in clinical settings, right, is your CO2, okay, and your bicarbonate and your pH. Okay, so a lot of times, like if we go to the arterial blood gases and compensation lab activity, all right, it has some links for you to read through, and these two really talk about these well. Okay, you have the self-evaluation quiz as well, but the ABG's worksheet. It's Friday, and these cases identify specific numbers. Okay, so let's look at Bob, for example. Bob is a 64-year-old male admitted to the ER for asthma. His laboratory results are as follows. He has a pH of 7.3. Okay, 7.3. All right. And he has a CO2 higher than normal and a bicarbonate higher than normal. All right. Now we learned I'm going to draw it on a piece of paper here. We learned in cardiovascular system and in the renal system here about our bicarbonate buffering system, right? So when we have H2O plus CO2, that reacts to create H2CO3, which is carbonic acid, which then becomes hydrogen ions and bicarbonate. Okay, looks like that. All right. I'm sure you can see that. Okay, so bicarbonate is, that system is one way we carry CO2 through our blood, but two, that interaction is a way we can manipulate and adjust our blood pH. So when we're looking at this situation, though, let's first figure out what is going on and diagnose this issue. Okay, the way to diagnose arterial blood gas is always the easiest way, and this is not about compensation, just looking at what's the issue, is this acronym ROME. Okay, and what that means is respiratory opposite metabolic equivalent. Okay, and you can look at it that in that order. Okay, and what we mean by respiratory opposite, what we're saying is if pH and CO2 are abnormal and opposite each other, meaning if pH is low and CO2 is higher than normal, that is a respiratory issue. Okay, if CO2 is lower than normal and pH is high, that is a respiratory issue. Okay, so let's look at Bob. Bob has a pH of 7.3 and his CO2 is high. Okay, so we would call that respiratory acidosis. Okay, now his bicarbonate is also higher than normal. Okay, why would his bicarbonate be higher than normal? It's because his body is trying to compensate. Okay, so when it says, is there evidence of compensation? Okay, that's why. Okay, it's trying to compensate. All right, our kidneys are holding on to bicarbonate and not letting it go out in the urine, and we're putting it back in the blood. Okay, so we're putting bicarb back in the blood, and there's ways we can do that. A lot of times it's the CO2 gets pulled in out of the tubules, and when it does, the cells break that down with water and convert it into bicarb, and then we actually push the hydrogen ions back out into the urine and the bicarb into the blood. Okay, so I'll draw a simple little diagram to explain that. So I'm just going to make it easy. Say to urine. Nothing like anatomy conversations here. So we're going to pull CO2 plus H2O out, produce H plus and HCO3 minus. H plus is going to go back in the urine. HCO minus is going to go to blood. Now, why does that help? Well, it helps pick up the hydrogen ions in the blood and convert back into the water and CO2. It shifts the equation. It shifts the balance in the blood. So we're able to buffer that pH, which is why that pH is 7.31 and the bicarb is much higher. Okay, so it's compensation. Now, why did asthma contribute to that? Well, asthma has a hard time getting air out of their lungs. Okay, so it has a hard time getting CO2 out in an asthma attack. Okay, that's the issue. Is sometimes it feels like you can't breathe, but it's because you can't get air out. Okay, and I know this personally. I was born with chronic asthma, and I kind of grew out of it. Never impacted me in sports, thankfully, but I had to have a mask when I was a little kid because I didn't have inhalers for the kids. We had to wear a mask 3 times a day. I did for 20 minutes to inhale the medicine to keep my bronchioles dilated where they're supposed to be and not get it inflamed. So asthma, not allowing that CO2 to get out, causes higher CO2 in the blood, dropping that pH, and the kidneys are trying to respond to that. So that's a respiratory acidosis, and it's being compensated. okay, because that HCO3 is high. If the bicarb was in the normal range, then it wouldn't be compensating, and we would just have respiratory acidosis. It wouldn't be compensated. All right, and compensation takes a while. Okay, metabolic or compensation by the kidneys is going to take a couple days. It's not going to happen right away. You can make more impact with respiratory compensation because you can breathe and move that stuff quicker than you can with the renal system. It takes a couple days for the renal system to compensate. Let's look at number 4. Okay, this case study with Kim. All right, and again, if you've already done these and you need to go back and change them and resubmit them, please, or to look at them. I guess you're not resubmitting them because it's a self-evaluation quiz. But if you need to go back and do any of it, please do. Okay, so Kim, 38-year-old woman. I should say woman, not women. I'll have to change that. Admitted to the hospital for bulimia. Okay, her laboratory results are as follows: pH 7.48, carbon dioxide is in the normal range, and bicarb is higher than normal. So let's go back and look at this. Okay, respiratory opposite. Well, carbon dioxide normal, so that's not a problem. Metabolic equal. What does that mean? Well, bicarb is considered the metabolic portion of these diagnostics. So when we look at this, pH is high, not extremely high, but it's high. Okay, or it's in the higher range a little bit. And bicarb is higher than normal. Okay, now she may not be in a metabolic alkalosis state because 7.48 isn't super high. Okay, but it's definitely above that 7.4, 7.45 range that we often see. But so it's getting higher. Okay, and you could say that this would be metabolic alkalosis. Okay, metabolic because HCO3 minus, bicarb, and the change to the pH are both equal in the direction they're going, or equivalent, I should say. They're headed in the same direction. All right. Now, how would we compensate for that? Okay. Well, we could work to put more CO2 in the blood to drop the pH, and we could also work on in the kidney taking HCO3 minus out of the blood. So we could reverse that equation and excrete HCO3 minus in the urine. So when we go back to this one, instead of putting HCO3 minus in the blood, we can reverse this whole thing and put hydrogen ions in the blood and HCO3 into the urine to balance the pH out. And again, that might take a couple days because it takes a little while for the renal system to compensate those issues. But if it was maybe, bulimia is a different issue, so the kidneys could compensate that. But if it was a renal situation, renal problems, then you might have to do something else to compensate or medicinally treat that issue. All right, so when you look at the arterial blood gases, you really got to pay attention to the pH first. Is the pH abnormal or normal? If it's abnormal, is the CO2 causing it? So is the CO2 out of its normal range, and is it opposite? Okay, and then the next thing is to then look at the bicarb and see if it's out of range, and is it the same or not? Okay, so make sure you follow that acronym ROME, respiratory opposite metabolic equivalent. Okay, and the Read ABGs Like a Boss link that's on your screen right now is a great place to learn. It's put together by nurses as well, so it's a good situation. But understanding ABGs is important because especially if you end up working in a situation, and not that you are going to be the one maybe making this determination, but you might be the one monitoring a patient that's on a ventilator. Okay, and this is even more important considering what we're seeing now with people on ventilators, right? And respiratory therapists deal with this, but they have to monitor those to make sure that people don't go into extreme values because they're on that ventilator. They have to make sure they're adjusting that ventilator appropriately to make sure the blood gases stay the way they are. Now, you can see some higher numbers in certain areas in blood gases or some kind of weird numbers, especially in the CO2 because of a ventilator. But you have to monitor the ABGs to make sure that the person isn't going into acidosis or alkalosis because of ventilators. Okay, so important thing to consider in the clinical setting, and many of you already work in hospitals or doctor's offices, so you maybe are familiar with these terms, familiar with these values, and you've seen them. And sometimes they might use different terminology in the medical field or in clinics to, in terms of how they decide their terminology of, of charting it or whatever it may be. I am definitely not a doctor, and I don't claim to be. So a lot of times doctors have their own methods and reasons for the way they have to chart and call or diagnose things. So my job is to help you understand what's going on physiologically so that you can understand the situation patients are in. So hopefully that was helpful in terms of looking at the arterial blood gases and compensation and understanding that, because sometimes that can be complicating to I'll move down here. To students. So as you finish up this next week, you got urinary acid-base end of module case study assignment. Make sure you include all the items on there. Some people have not been including the items I list in those case studies or those assessments. Make sure you include all the items on there, okay, and underline them or highlight them. One, it makes it easier for me to grade. Two, it makes sure you're covering the right information, and it's another chance to learn, okay? You also have the reproductive system that you have to do by December 9th. It's really not much. It's just a case study with some questions in the case study. It shouldn't take you very long. I really grade that more on completion. You need to do it, and I scan it to make sure that you've done it all. But I'm really looking for you just to do that as a learning exercise, and you'll get the points for that. So make sure you complete that. And the other thing you can complete is a HAPS exam for extra credit. This exam will allow you to take a cumulative test, multiple choice. It's timed. Don't use notes. Just take it off your head. You'd be impressed with how much you know. I know there are some questions in there that are weirdly worded or grammatically need help. A part of that is I've gotten this from a national site, and I need to go through and edit it. I just haven't had time. But I'm trying to be consistent with what they're doing with their national tests, and it gives us a chance to look at how we score compared to the nation, but it also gives you a chance to prove that you know this information and can get extra credit. So if you score above a certain number, which it's listed on there, when you go into the exam, it's listed here, you can get extra credit points. So if you're 70 and above is an 8, 60 to 70 is a 6, and I've already seen a few people score above a 60. I think in the summer or spring, I had 2 people score 96, which was super impressive. And I put a time limit of 100 minutes, which is plenty of time if you just sit down, don't look at notes, and take the assessment. So I look forward to seeing how you do. I look forward to your future success, and please reach out to me if you have any questions, as always. And I just really have enjoyed this quarter, and I wish you the best and have a wonderful break. Take care. Bye.